Hi, everyone, and welcome to ACSLPA's webinar, which is called ACSLPA Standards and Guidelines, What Members Need to Know, Revised Working with Support Personnel Guideline and Clinical Supervision Standard of Practice. I can say that we've never really been short on long titles. My name is Sandy Nicol. I'm the Director of Professional Practice, and I'm going to moderate today, and so I will give us just a little bit of housekeeping to get us started. So we are using Teams live events today, and as such, there is not a way for you to chat among yourselves, so you won't be able to use your camera or your microphone. There is a Q&A section where you can write your questions. So that section does look like a couple of little interlocking chat bubbles on your menu bar. So once you write in your questions and once they're approved by the moderators, it will show up in the featured section of the Q&A box. We will try to get to all the questions at the end, but please do write down your questions in the Q&A box as they come to you, so anytime throughout the presentation. You can upvote any of your questions that you want to have answered. So please like those questions in the Q&A box. That's putting a little check mark on the little thumb. And then those ones with the most likes will be the ones we make sure that we get to first off. And the session is being recorded today and will be available on the ACSLPA YouTube channel within about a week. So today, it's my pleasure to welcome Susan Raffett, who is ACSLPA's Deputy Registrar. So Susan is an SLP by training, and I can honestly say that I think I've known Susan for about 25 years, maybe a little bit longer, so now we're dated. But Susan has been with the college since 2008, and many of you know Susan, or at least have had conversations with her once or twice. So without further ado, Susan, I'm going to turn it over to you for an overview of our standard and guideline.
Great. Thank you very much, Sandy. It's a pleasure to be here this afternoon to provide an update regarding our revised documents. And so I will work through my presentation. And as Sandy said, please do type in your questions if you have any, and we'll make sure we get to those at the end of the presentation. So I'm going to start with today's learning objectives, and that they are really to obtain an overview of the newly revised guideline on working with support personnel and the accompanying standard of practice on clinical supervision, to consider supervision from a right touch regulatory framework, which focuses on minimization of risk to the client, and I will discuss this in more depth as we go today. And then to, of course, highlight notable changes and the rationale for those changes on this revised, on the revised guideline and standard of practice. So I'm going to just take a moment to talk a little bit about regulation and what that encompasses as opposed to member or professional advocacy, just kind of to set the stage for the documents that we're discussing today. We often receive feedback from regulated members with concerns about caseload sizes, asking us to advocate with employers regarding the need for additional resources, including time to adequately supervise support personnel. And while these are valid concerns, and I don't want to diminish them in any way, unfortunately, they really fall outside the scope of what our legislation allows us to do as a regulator. Those of you who are part of the webinar we held last week that talked about some upcoming amendments to the Health Professions Act and the distinction between a regulator and a professional association, you know, this will be a repeat for you, but essentially the split between regulatory functions and any perceived association or member services has become much greater in the past number of years right across regulation, I would say across the country, but certainly in Alberta in the last few months this has really been highlighted. And so some of the upcoming changes to the Health Professions Act strictly separate any association type functions from regulatory functions. So you know, to that end then, the standards and guidelines that we develop and that we share with you are really focused on the individual requirements of regulated practitioners, and they relate to safe, competent, and ethical delivery of services. And they're really about individual practitioners rather than about the ability for us to advocate broader sort of professional kind of focused changes, you know, by government, by agencies, or others. Certainly, we do encourage you to use these documents as a jumping off point, though, for discussions with administrators and employers regarding how, you know, you guys can together ensure that these considerations are addressed adequately in the work environment. Because I think sometimes employers may not be aware that we have requirements of professionals, and that you know, once they become aware of those, then they can work collaboratively with you to try and put in place what's needed. I'll talk about this a little bit later as we proceed through the presentation, because we do have a couple of resources that might be helpful to you if you do need to have conversations like that. But just kind of wanted to set the stage with that item today. So now I'm going to move on to the next slide, which is just a quick reminder about the types of documents we're going to be discussing today and how they're defined. So standards of practice are established measures or norms that define the minimum level of professional performance that SLPs and audiologists must demonstrate in their practice. So these are kind of the hard and fast rules, if you will, the expectations of professionals. And if there was ever a complaint or a concern that came forward about someone's practice, the college would look to the standards of practice and whether the member had met those requirements. And so I think for that reason alone, it's really important that you're aware of what those are. Guidelines, on the other hand, provide recommendations to members that are deemed to be acceptable practice within regulatory requirements. So here you're afforded some use of your professional judgment in the application of a guideline. They're a little more flexible than a standard, and they provide really some suggestions on ways to meet the standards of practice dependent on the clinical context that you find yourself in. So you'll probably notice too that as we've revised some of our standards over the last few years, we have really made an effort to make them a little more explicit and a little more specific. And this is to ensure that we're providing clear guidance to members regarding the expectations of practice. So just wanted to kind of mention that. I'll move to the next slide then. So really, in other words, I would say that good decision making as a clinician, as a professional, is really the intersection point of these three items. So we have an understanding of standards or minimum requirements. We have guidelines that allow for some flexibility of implementation, dependent on your clinical context and some other factors. And then we overlay on that professional judgment of the SLP or the audiologist. So you would bring your knowledge, your skills, your abilities, and your experience to the situation. I kind of liken it to what we do as SLPs and audiologists in our day-to-day clinical practice. You know, you consider the evidence, you consider the context, and you make decisions based on your knowledge and your experience. And you base those decisions on sound rationale. So I'll move on to the next slide now, which is moving us into a bit of a discussion of right touch regulation. And right touch regulatory perspective is a construct that we've really begun to make use of at ACSLPA as part of our decision making. It's an approach that comes out of the United Kingdom, and there are many articles and resources on this. If anyone is interested, just shoot me an email and I'm happy to share those resources with you. This slide is really going to give you right touch regulation at about 40,000 feet above sea level. It's a really rudimentary overview, but basically it focuses on the minimum regulatory force that's required to achieve the desired result. So if you have too little, you know, too few requirements, too few kinds of regulations, if you will, it's ineffective, right? People are just kind of all doing their own thing. If you have too many regulations and restrictions, it can be perhaps a waste of effort depending on the context and the situation you find yourself in. The analogy that I've heard used is that we don't want to use a sledgehammer to kill a fly when a fly swatter will do, and it might be a rather crass kind of an analogy, but the idea is that you don't want to go overboard with restrictions or limitations on people's practice, but there needs to be enough regulation that the risk to the client is handled appropriately. And so that really, I think, has become our mantra over the last probably year to 18 months at ACSLPA is, you know, when we make decisions, we're thinking about the clients that we serve, and we're thinking about what the risk to the client might be, and so what kind of regulation might be needed. So moving to the next slide then, right touch regulation, as I said, we consider and minimize potential hazards, risks, and harms to the client. And in healthcare, harm is physical injury or psychological distress that is experienced potentially by our clients. So from a physical perspective, we can think about restricted activities, which would be those activities that are considered to be the most physically invasive and potentially risky interventions for the client. We can also think about harm in terms of clients not receiving the most appropriate intervention for their particular issue, or their progress being hampered because ineffective or inappropriate targets were focused on in intervention. You know, those kinds of things might be considered risk. So moving on then, as we think about regulatory questions related to the supervision of support personnel, some of the questions that might arise would be listed on this slide. You know, we're going to think about what types of restrictions are required when support personnel are providing speech, language, and audiology services under the professional supervision. How much supervision is enough? How much supervision is too much? How does a professional make good decisions when assigning, monitoring, and evaluating assistance? In my opinion, I have to say, I think it's probably better to err on the side of caution initially and to adjust accordingly versus providing too much leeway and not providing enough supervision and then realizing, uh-oh, I've got a problem here and I need to pull in the reins. So that doesn't mean we advocate rigidity. The whole purpose of a right touch model is to look at the factors that might impact risk and to adjust accordingly. So if you're unsure, we encourage you to speak to colleagues, to supervisors, and to mentors to think about what a trusted colleague might do in a given situation. And certainly feel free to contact ACSLPA for practice advice. Both Sandy and Cheryl, as our Director of Professional Practice and our audiology practice advisor, are available and welcome your questions. So please keep that in mind. So to summarize then, I'm going to go to the next slide. Context really does matter. When you think about a right touch framework and you're thinking about the supervision you're providing and how you're managing this, your context is going to matter. Your clinical judgment and your decision making are important. You know, and we're going to look to you to make sound judgments and to have sound rationales for your judgments. And that's what you do every day in your work, you know, and you do that all the time. And this is really no different. We're going to impose absolutes only when they're deemed to be absolutely necessary. So again, there is flexibility in how you make decisions. So again, I go back to my Venn diagram because I think, to reiterate, it really is a combination of reviewing documents such as standards and guidelines, being aware of minimum requirements, and then overlaying with your professional judgment based on your training and experience. You seek out additional input as required, whether that's the latest and greatest in terms of lit reviews and evidence-based practice, whether it's consulting with colleagues, maybe you're trialing some things, and you're always maintaining transparency with your clients about what it is you're doing and why you're doing it. So then, in terms of context, and we consider the level of risk to the client. The items that are listed on this slide come from Table 3 in the guideline, and I really urge you to take a look at Table 3 because I think it does a great job of kind of laying out all the factors one needs to think about as they move into supervision. Certain activities by their nature, for example, are going to be more risky than others. And so you're going to have to think about whether you assign them and who you assign them to and how much supervision you provide for them. Each individual client is going to bring more or less complexity with them to the situation, dependent on the nature of their communication, their hearing, or their swallowing concern, and any other factors that they might be dealing with, health factors, social emotional factors, or familial factors. And then, of course, there is the competency and confidence of the support person themselves. How much experience with a given issue do they have? And then also, what is the relationship between yourself as the supervisor and the support person? Have you worked together for a long time? Do you have an established trusting relationship? Or is this a brand new working relationship and you're not really sure what this person's competencies and capabilities are? All of these factors are going to come into play when you're deciding how you're going to work together with this person and work on behalf of your client. So enough said on that. I'm now going to kind of twist a little bit away from talking about risk and talk about a few of the notable revisions to the guideline and to our standards. There are kind of 3 significant areas of change in the new guideline and standards that I'm going to talk about today, and they are assignment of activities that involve interpretation by a support person, determinations regarding the amount of direct and indirect supervision required, and clinically supervising one's employer. So just as I said with the last slide, the decision-making tables and rubrics that we have support the notion of less rigid minimums and maximums or cans and cannots, more determinations based on specific clinical situations that you find yourself in and the level of risk or concern to the client. So let's start with implementation versus interpretation. Historically, our guidelines and standards indicated that interpretation was solely the domain of the professional and that implementation of assigned tasks and duties was the domain of the support person. And I think we still are saying that interpretation, including decisions around assessment and diagnosis, changes in treatment plans as examples, all continue to be in the domain of the professional. But what we are saying, if there is a clearly documented algorithm or flow chart that provides a clear decision-making path that leads to a particular outcome, then the support person may be able to participate in that component of the whole flow chart or plan. So in this kind of a situation, the interpretation has really been prescribed and outlined by the professional, and the support person is expected to follow through directly as the flow chart outlines. So any deviation from the flow chart would require input by the supervising professional. And in the guideline, I think we have an example of hearing screening and sort of how that's flowed out. And if all of those different steps kind of in the process are laid out and it's clear, for example, that if the individual has has passed the hearing screening, then they don't need to come back to be seen by someone else. They can be discharged, and that's clearly outlined in the flow chart. Then the support person is able to do that. So that would just be an example of how you could lay out a flow chart that involves the interpretation and includes the interpretation already that's been prescribed by the professional. So again, I refer you to the guideline to have a look at this. Pages 8 to 9 of the guideline talk about this this indicator a little bit more, and the standard of practice, it's indicators D and E that speak to this particular topic. Moving along then to the next substantive change to the guideline is the amount of supervision that is required by the supervisor. We're no longer imposing a specific amount of supervision by SLPs, but rather we are encouraging the SLP and the audiologist to determine how much direct and indirect supervision is going to be required based on the particular situation. And this is a change from our previous guideline for SLPs, which stated the amount of direct and indirect supervision that was required. So we're moving away from that, as the context and clinical judgment will drive the best decisions in this regard. It's that idea, again, I go back to, we're not painting everyone with the same brush. We're not saying you need a sledgehammer to hit a fly, right? It depends on the situation, and you know the situation, and you're looking at table 3 and you're determining the factors that you're dealing with, and you're making a decision about how much direct and indirect supervision is needed. We're not saying no supervision is needed. There will always be a component of supervision that is needed, but it's up to you to make that decision and to know your rationale for that. Because if you're called onto the carpet to justify it, then you need to know and you need to be able to state what it is. So I just want to also clarify that in the past we had 2 separate guidelines, one for SLPs and one for audiologists. And I believe the SLP guideline had the prescribed amounts of direct and indirect supervision, but the audiology guideline did not. So we've now collapsed the 2 guidelines into one. The committee that was involved with this felt that we could handle both professions with one guideline. And so, so now the requirements are the same for both professions. Okay, and then the final substantive change that I'd like to address today is the one outlined on this slide, which is that the regulated member will refrain from entering into an employment agreement whereby they clinically supervise the person who employs them. Now, on first glance, you might wonder about that statement, but the situation has come up where a support person has decided they're going to run their own business, and they have hired an SLP or SLPs to supervise them. And I say SLPs because in my experience, I don't think this has happened in the audiology realm. Don't quote me, but I'm not aware of it. So the example that I'm bringing up is where a support person has hired an SLP to supervise them. The issue in this case is really one of professional ethics. And the question that comes up is, how easy is it to supervise someone when they are essentially the keeper of the purse strings and they're paying your salary? So, you know, we looked to sister colleges across the country and found that they have also prohibited this type of a scenario. As you know, we don't regulate support personnel. They are not regulated, and so we can't really speak to their practices. We can't prevent them from starting up their own businesses. So this standard is really focused on professionals like you, and to make you aware of this requirement. So the idea here is that instead of being hired by a support person, there might be some other ways to work around this type of situation. So for example, rather than having the SLP being an employee or contractor of the support person, maybe the agency or the individual who's seeking services could contract separately with the SLP and with the support person. And this way, they are the employer, the agency or the individual, and there's no conflict in terms of the SLP needing to provide supervisory feedback to someone who might be in a position of authority over them. The SLP, another option would be that the SLP could hire the support person because they are then the employer and also providing supervisory input, and those 2 items really are consistent with one another. You know, the concern ultimately in this case is that, you know, if you're hired by someone that you're supposed to be providing clinical supervision to and you have concerns about their clinical practice, but they're paying your paycheck, you're in a really awkward situation. And you know, it may prevent you from being as truthful as you might otherwise be. It might also, you know, result in that other individual deciding they no longer want your services, when really you're just doing your job. So, you know, again, this is not a common occurrence by any means, but it's something that we felt needed to be addressed as part of our guideline and standard. All right, so enough said, I think, on that one. I'm now going to step back from the big changes in the guidelines in the document just to talk a little bit about the document development process so that you're aware of the steps that went into the final products that we're discussing today. Obviously, a need for the document revision was identified, and this came from individual members contacting the college, as well as from staff identifying a need for change based on some changing trends in this area. And also, I have to say, simply the passage of time. The last versions of these documents, well, of the guidelines, they were developed in 2011, which is like 10 years ago, so getting a little long in the tooth and really wanting to make some changes. We chose to contract a consultant for this work, and I would like to send a shout out to Wendy Mitchell, who's a registered speech-language pathologist with ACSLPA, who took on the job of completing this work on our behalf. You may recall a survey that was sent out to members several months ago, asking for feedback regarding working with support personnel, and you'll see on the slide that we received a very large response to this survey, which was great to see. And that survey information was then coupled with a review of the literature and benchmarking with other colleges to arrive at the draft guideline and the draft standard of practice that were discussed and debated by the Supervision and Support Personnel Ad Hoc Committee. Now, that committee is a group of regulated SLPs and audiologists who volunteered their time to participate on the committee, and I would also like to send a shout out to them and extend our thanks. And I'm going to tell you who these folks are because we really appreciated their involvement. I'd like to thank Rochelle Viray, Nancy Bazandowski, Kevin Linland, Nosheen Khan, Cindy Pruden, Melissa Scotchless, Melissa McAllister, Marion Zeman, and ACSLPA staff Cheryl Blair and Sandy Nickel. So once the group debated and revised, and I would have to say did a fair amount of that, and Wendy kind of incorporated all of those changes into the draft documents, a final draft of both the guideline and standard of practice were ready and were then circulated back to the membership again for vetting. Then they received a final round of revisions based on some of the feedback from the member vetting, and then went to ACSLPA Council for approvals and next steps. So you can see it's a pretty stringent process that we go through when we develop and revise our documents, and so I think I hope it gives you a feeling of comfort knowing that you know, a lot of care and deliberation and reflection has gone into the work that you see before you now. All right, I'll move to the next slide. Just a few additional quick asides on the guideline, in particular, actually, and the standard, I guess, as well. But the guideline is in quite a user-friendly format now, I think, with easy access to links and resources embedded in the document. The appendices can be easily accessed as standalone documents to be shared with colleagues and clients and administrators. So if there's something that, for instance, you'd like to share with an employer, some of the key tables, etc., can easily be just photocopied out of those appendices and utilized. The revised standard of practice indicators are also embedded directly in the guideline, so it's easy to see how they work with and complement the guideline. So our standards of practice have to undergo an external stakeholder consultation through a process overseen by the provincial government. And while colleges don't have to act on that feedback, they do have to review it and consider the feedback that has been provided to them. So unfortunately, with the pandemic and many competing demands on Alberta Health's plate, the review of standards of practice has been really delayed, I would say, in the last year. And just as an example, we sent in some standards on our documentation and records management last June, and we are still waiting to receive the feedback on those standards. I've been told we'll be getting that this month, so hopefully that will be wrapped up soon, but I'm anticipating we're going to have a similar trajectory with the clinical supervision standard. And so what that means is that until we get that feedback and have a chance to review it, our current standard on clinical supervision, which was developed in 2015, is going to remain in place until we can review the feedback on the new standard. So in the meantime, we encourage you to become familiar with the new standard and to begin incorporating elements of it into your practice where possible. The revised guideline has been approved by Council and is now in place. And all of these documents are available on the ACSLPA website. If you go in for, I think if you go in on the menu where we're looking for items, documents for members, and then you go to key college documents, you'll see these items. The new waiting for approval standard and the 2015 standard on clinical practice are side by side on the website. You'll see them there. And then, of course, the guideline is there as well. This is where I wanted to mention a supplemental resource. So as I said earlier, we've also developed a supplemental article that was developed in response to some of the questions and concerns that have come up regarding awkward situations where you become aware that assistants are perhaps being utilized in the absence of professional supervision. I mean, I think we all know these have been challenging times in Alberta in terms of speech pathology, particularly, and so in some environments, you know, we've heard that assistants have been used perhaps without the type of supervision we've come to expect, and so the article just is kind of a summary of some points that you could highlight with administrators, with employers, that kind of speak to why we have rules around supervision of support personnel. So I urge you to have a look at it. And again, if you have any questions, happy to answer those questions or to have further conversation with you. Sandy and myself and Cheryl remain available for that kind of consultation. I think that sums it up in terms of the formal components of the presentation, and I will turn it back over to Sandy to facilitate a Q&A. And Sandy, I just need to ask you, should I be muting myself at this point, or should I be remaining on the line?
I would say stay live on the line, Susan.
Okay.
And
okay.
I think we'll probably leave you up on the picture most of the time rather than going back and forth between you and I. And I will just continue to be the voice in the night for our members and the questions. So we do have several questions that have come in, and I might not ask them in the same order in which they came in. And so one of the questions which I think I addressed was, when does the guideline take effect? And so really the guideline's in place now. It's available on the website. And the standards of practice, as Susan, as you've mentioned, the standards are coming a little bit on the Government of Alberta's timeline. So we have a little bit of a wait time there. And but in the meanwhile, you know, the 2015 standard still exists there, but it would be good for members to be looking and starting to get themselves familiar with the new standards. There probably won't be significant amounts of change to those, and there's none of the new standards are less than the old standards, so it's a good thing to start thinking about those. So anything else you want to add there, Susan?
No, I'd agree with you. Like, I think anyone who moves to kind of practicing under the new standards is not going to be faulted for doing that. You know, really the only reason we can't just put them in place today is because of this requirement for the external stakeholder consultation. So I think, you know, I think what we're saying is because we can't formally approve them, we need to keep the other ones up and in place. But I think either are acceptable, and just to kind of be working towards the new standards, to the extent that's possible.
Perfect. So one of the questions was specific to the old 10% rule that we used to have in the speech pathologists guideline. So is that 10% rule no longer in place?
That is correct. There is no rule around the 10%. And in fact, you'll notice that we didn't actually even have that in our standards. And this is where we've kind of evolved over time as a college, where in the old days we had these kind of broad generic standards, and then we had a lot of detail in the guidelines. Where we've kind of moved, consistent with regulation and with kind of input from legal counsel and all the rest, is we've moved to a place where we recognize it's more important to have some real kind of hard and fast clarifications in our standards, and the guideline kind of embellishes that and broadens it out. So, so the 10% is no longer a requirement. As I said previously, that doesn't mean there are no requirements for supervision. If anything, the opposite is true. There are absolutely requirements for supervision, but it's up to you as the professional to determine what is required, keeping in mind all of the factors that are outlined in the guideline that you need to consider when you're making that kind of a determination.
Yeah, and I think one of the things that I'd chime in on there, Susan, is just that in some cases you might have to do more than 10% of supervision. For those assistants, you might have assistants that are new, or support personnel that are new. You might have support personnel that are still kind of in that training mode. You might have support personnel that maybe they've been working for a long time, but the kind of client that you've assigned to them has more complexities. And so there can be lots of factors that help you determine just how much you're going to supervise.
Absolutely.
Okay. Yeah, so let me ask the next question. So there is a question, I know that you've addressed part of it, Susan, with the supplemental article that's available, but are there any resources that ACSLPA can point members to help when they're trying to decide how much supervision is appropriate? So particularly for those who might be put in the position of trying to explain to employers why less than a certain amount of direct supervision really isn't, maybe it's not ethical, or it could compromise the client.
Well, I would hope that our guideline really does a good job of that. So, I mean, I think that would be my first thought, is to really kind of go through the guideline with a fine-tooth comb. That would be my initial thought. Certainly, Alberta Health Services has some documents that talk about, assignment, monitoring, and evaluation of assistants. Of course, we make reference to those in our guideline. And again, keeping kind of with the literature, some of this work has also come out of Australia. But again, it's really consistent with what we've got in our guidelines and documents. I do think the supplemental article that Sandy mentioned you might find helpful, because it really speaks to what is it that we bring to the table as SLPs and audiologists? Like, why are we needed in the first place? And there are reasons for why it's important to have supervision, because we are looking at things through a lens that somebody without the level of training that we have might not be looking at. And so, we need to keep things in mind, what's actually going on for this client. If they're having trouble with a task, why are they having trouble? Maybe it's just not that we need to keep trying the same approach to getting them to, make that target differently. Maybe that there's something else going on that we need to start looking into. Maybe they need a referral to another health professional because there's another underlying, component of, that something that's going on for them, whether that be psychological, whether it be a hearing referral by an SLP, whether it be a motor issue that we need to get a handle on. So I think these are all the kinds of things that, you know, let's take this back to the bigger picture, and let's also always remember that we're focusing on the need of the client. And I think sometimes it gets, you know, it can be really challenging when there's not a lot of money, there's not a lot of time, there's not a lot of resources. But like, why are we doing this? We're doing it for the client, and let's stay focused on the client. So those would be some thoughts.
Perfect. Okay, so we do have a few more questions here. So one of the questions is, we use a shoebox auditory electronic hearing screen device. For hearing screens, are you recommending that our SLP assistants not be permitted to conduct these independently? And I'm afraid I'm not familiar enough with what that practice might actually look like. Not sure, Susan, if you know more about.
Well, I mean, I think I've heard of this, and you know, I'm not sure. So you're asking, maybe Sandy, can you just repeat the question? They're asking whether people can do this independently?
Correct. If the assistants would be able to conduct those independently.
Well, I think it comes back to what we talked about previously. I mean, first of all, are they trained? Do they know how to perform this activity? You know, and you know, so do they have a competence with it? Are you comfortable that they have a competence with it? And then if there are decisions that are coming out of that they need to implement that involve interpretation, have you, as the SLP or audiologist, clarified what the course of action is? So what's the next step in the flow chart? Like if they behave this way and they respond in these ways, then you do this. If they respond in these ways, then you do this. I think if you've done all that and you are monitoring that situation, then I believe they can do that independently. However, like anything, there's still a level of supervision, right? You're the one who assigned the task, you're the one who's monitoring what's going on, and you're the one who's evaluating whether or not they're doing it correctly.
Perfect, and that's what I would have said as well, right? Still that element of some degree of supervision, and the amount of supervision will be based on that clinical judgment. And some of those factors in the guideline that you'll see, those risk factors attached to the decision about how much you need to supervise. So I think that most members will find the table that's in the guideline around risk really, really helpful. So we do have another sort of a question, it's sort of a comment, but maybe Susan, you want to entertain it a bit. But when the discussion occurred around assistants or not being able to supervise one's employer, then the question / comment really was, I wonder if this will make speech language consultants, i.e. those that are non-SLPs, stop practicing, or if they'll just practice without SLP input at all. I'm not sure if you want to comment on that, Susan.
Yeah, I mean, well, a few different thoughts on that, I guess. First of all, I mean, speech language consultants, if we're thinking of an assistant calling themselves a consultant, that might not be the most appropriate title to be used, but I realize that might happen sometimes. Certainly, though, there can be questions, and I mean, we've had concerns and questions come to the college where we've had employers or contracting agencies recognize that that's a title that they're not really as aware of or as familiar with, and is that person actually a registered speech language pathologist? And they've actually come and looked at our register and then, you know, discovered they are or they are not. And so I think that awareness of title and the importance of title and being able to check that. I think also the fact that, you know, while we don't regulate assistants, there are a few tools we have available to us. And one of them is that if somebody holds themselves out as a regulated professional, we can kind of challenge that and look into that and request that they kind of cease and desist on that front. So there is that. And so I think, you know, part of this is about that awareness of contracting agencies and individuals, understanding what they're getting and you know, who are they hiring, and then understanding about the importance of supervision. And I have been heartened to see that that has happened. I think you're right, though. You know, are there going to be situations where people are out there hiring themselves out without supervision? There may well be. And you know, what can we do about that? We can educate to the best of our ability. We can explain why it's important, and you know, those kinds of things. Beyond that, I'm not sure. I'm not sure what more we can do.
Yeah, and I think it's a good it's a segue into some of the questions that we have sitting here, but it's a, you know, that educating and I guess advocating on behalf of the profession or professions and what we do and what sets us apart and being different. Well, it's not a role for ACSLPA as a regulatory body. It could be a role for an association in the province. So for example, we have Speech, Language and Audiology Canada, who's the national association, but in Alberta we don't have a provincial association in Alberta. There are a couple of associations that do exist, but they may not have that provincial landscape. So that will segue us into a couple of the other questions that are in the window. But before I get to that or those questions, a new question just popped in, and it's a good one. So what is there to stop employers from replacing their staff SLPs with outside contracted SLPs who are willing to write a treatment plan and provide less or no direct supervision?
Well, I mean, I don't know. I guess there are a few thoughts that come into my mind on that, and Sandy, you can certainly chime in as well. I would say one thing that should stop them from doing that is SLPs themselves. SLPs themselves should be saying, this is how this works. This is what I bring to the equation. This is why it's important that we have a certain amount of supervision. And that's why the supplemental article that we wrote kind of speaks to some of this, to kind of make it clear why it's important that supervision is involved. So I think we all have an ethical responsibility on that level. I realize times are tight, and I realize people are, you know, looking for work, and so there are those components. But I think it's a fine line, and I think that we need to remember as professionals that we educate, we inform, and we do the best that we can. And, you know, sometimes if you can't make an employer change how they do something, you can still record your dissent with that in a very polite way. You can document the concern that you have, and then you do the piece that you can do, and you recognize what you don't have control over. Sometimes people have to draw hard lines in the sand and say, I can't do that. And that is going to impact. And you know, I don't know about others out there. I suspect many of you have had those those lines in the sand. I know I've had them, and you just have to make those decisions. So again, you know, I hope that we educate. We try to educate where we can. We try to have inroads where we can with employers. With you know, as I said earlier, we're not in the advocacy business. That's not what we were set up to do. But where we can, we take the opportunity to share concerns.
For sure, I would say that we definitely try to influence where we can. Mm-hmm. Yeah, well, it might not be a capital A advocacy that we do. There's still questions coming in here, so let me just see what's new. Yeah, so somebody made a comment. I won't necessarily publish this one, but there are some school divisions that are doing that. Right, they're contracting SLPs. They might come in, they do the assessment, and then the SLP is gone, and then they're using support personnel to, whether that be educational assistants or SLP assistants, to actually complete the treatment. And I would venture to say that we have also heard of some issues where they might not even have an up-to-date assessment, where those educational assistants are working off of old assessments and providing treatment. And so there are some things here that are all the comments that have been sitting here, right? Some school divisions are already doing this. Somebody said, I hope SLPs would not be doing that, right? As a person who contracts, I'd never agree to a contract that expected me to work under that model. And yet we do know that I think that there probably are some SLPs who are doing that. And in part of that, I think it may in fact be the times that we're living in, and so fiscally restrained right now. And so decisions are very complex.
I think Sandy, I would just add something there is, it might be an opportunity for people who are into situations, they become aware of this, take a read of the supplemental article. If you think it's appropriate, leave that on somebody's desktop when you're in the school. Because sometimes people do things and they don't really think through the consequences. And, new models can come into being. Like, we are in a place of transition right now. And so, the old ways that things were done, they may be changing, but it doesn't mean that we cannot begin to re-implement and have new approaches, different ways maybe of supervision. And there might be some strategic ways to think about, well, how are we going to manage this? Or, okay, somebody in an administrative role heard me, and I'm not going to be able to supervise everybody for every purpose, but we're going to pick a few key issues that are just too important. The risk is too high without supervision, and we're going to run with it. Or we're going to pilot it. I mean, I love that word, pilot. Let's try it. Let's just see. Will you let us try something? Let's see how it works. What's the quality of care we're going to get out of this? What's the quality? What's the how happy are families and teachers going to be if we can implement something that has a little bit more supervision involved, for instance, right? So I think those things become important to think about.
Yeah, and for sure, I've had conversations with members, and really that component around having that dialogue with those employers is really a good starting point. And lots of times there's, now that that hard and fast 10% rule has been removed, there can be a lot of flexibility around how that supervision looks. And in a new world that we're all living in, which is all virtual, it seems, there might even be more opportunities for supervision in a different way. So maybe that employer or agency actually just hasn't thought about that at this point. So I think there are some good things to ask. Now, the last couple of questions that are here, they're from the same flavor, for lack of a better word. But the first question that came in, and I don't know if the person had an opportunity to attend last week's chat with members that we had just around regulatory versus association, but I'll plug it here. We have one of those happening again tomorrow. There's still space for about 15 people. The question is, what do you suggest our professional body pursue in order to grow and maintain advocacy for SLPs, especially given the current situation we're all facing with unprecedented cuts to funding and to our services?
Yeah, I would say if you didn't participate in last week's discussion and you have the availability to participate in this week's discussion, it might be good to have to join tomorrow. I think is another webinar. Not that ACSLPA has all the answers on this, but it's just kind of, are there like-minded people who can come together to think about what we need in this province that could be more of an advocacy focus? I think that would be one idea. I also think, and this is my own personal plug, right? I've been an SLP for more years than I care to admit. We have to be really strong in the belief that what we bring to the table has value. We need to be clear about what is appropriate and not appropriate for our clients. We need to, I think, not be afraid to say when a service delivery model will work and when it won't work. And I realize these are challenging. These are challenging conversations to have, but I really think, we know our business, and so we want to be effective. Like, we don't want to water down so much that people go, well, what is that? That didn't make any difference. So I do think it's that kind of owning our profession and owning it proudly, and just like doing what we can. It's just a tough time right now, and yeah. I don't know, Sandy, if you'd add anything.
Yeah, and I just started typing a message, and I'm sorry I didn't mute while I was doing that, so some of you may have heard my clicking on the keyboard, but I'm just going to post an announcement to the group. But there is a Facebook group that has started in the province by SLPs who are entertaining the possibility of whether or not a provincial association can be started. And so it's a closed Facebook group. You need to be a registered member with ACSLPA. So by registered, that's either practicing or non-practicing in order to join. But I posted the name of it. So it is a Facebook page. And so you can search for SLP advocacy in Alberta. And that might be something that members or folks on the call are interested in. And I would say that there's a bit more of a groundswell right now around that advocacy piece and the fact that it's kind of a gap in the province for sure. Okay, and questions still are rolling in. There was a question that was related to the association regulatory kind of a vein there. So if ACSLPA is serving only as a regulatory body, will there be a document that's developed that the public would be able to access that would offer, important questions that they could ask prospective SLPs or audiologists, or some kind of a support document for them that would help them vet who they would be contracting? So to be able to know that that person's practicing ethically and within published guidelines.
Interesting. I don't know. I mean, that might be something we could think about. I mean, we do have some items on the website that talk about sort of how do you know your SLP is qualified? How do you know, and your audiologist, and a little bit of conversation about the difference between a hearing aid practitioner and audiologist, for example. So there is some information like that available on the website. I'm just sort of trying to think. I guess what you're asking for is something maybe that's a little more tailored to when you're perhaps looking for a private practitioner, or when you're looking for, or that you're aware that there are support personnel who provide services, but they should be under the supervision of a professional, that sort of thing. I think that's something we could think about.
For sure.
And I guess it's just a matter of, how we would, just pull that together.
Right. So one of the things that we've done with ACSLPA is we're just, we've been working on, sorry, I'm losing my voice, folks. We've been working on what we would call a find a practitioner database, for lack of a better word. So it is